Metro Health is a really busy Level 1 trauma center. We do a lot of fast exams here. I'm often asked how I can do the fast exam so quickly. So we're going to demonstrate how to do the fast exam quickly and accurately. We're also going to demonstrate some positive findings of the fast exam. Our ultrasound machine is ready to go at the bedside. We're going to use the fast setup on our machine. Most ED machines will have a fast setup. If you don't, you can use the abdominal preset. You can use either the standard abdominal transducer or the cardiac transducer for this exam. Some people like the cardiac transducer because its small footprint fits right between the ribs. Other people like the abdominal transducer because it tends to give you a clearer image. Since we're going to be looking at 4 spaces for free fluid during the exam, I'm going to make a diamond of gel on the patient, connecting each of the spaces: the right upper quadrant, the pelvis, the left upper quadrant, and the subxiphoid view of the heart. For this exam, I'm going to use the cardiac transducer. We'll show you all 4 windows and then an alternative cardiac view. For the right upper quadrant view, we'll start in about the mid-axillary line at the 8th intercostal space. The indicator goes towards the patient's head. On the screen, the indicator on the monitor corresponds with the indicator on the transducer. So the patient's head is towards the left of the screen, and the patient's feet are towards the right of the screen. To locate the kidney, slide the transducer up and down the torso as needed. If all you can see is bowel gas, the transducer is too low in the abdomen, and you need to slide up towards the head until you can see the kidney and the liver. Rotate the transducer so that the kidney is in long axis and you can see the interface between the kidney and the liver. This is the area known as Morrison's pouch, with the liver on the left side of the screen and the kidney on the right. Next, slide the transducer towards the patient's head so the diaphragm is visualized. It's important to see both above and below the diaphragm. The next view is the pelvic window. Slide the transducer along the flank and over to the center of the abdomen. Place the transducer in the lower abdomen in the sagittal plane with the indicator towards the patient's head. In this view, the bladder is seen surrounded by bowel. It is very important that the bladder be full in order to get an adequate pelvic window. The next view is the left upper quadrant view. For this window, slide the transducer along the patient's flank up to the left side with the indicator towards the patient's head. The spleen is smaller than the liver, so the splenorenal fossa is often more superior and more posterior than the hepatorenal fossa. In order to get this view, you may actually have to lay your hand on the bed. Just like with the right upper quadrant view, it's important to rotate and slide the transducer as needed so that the spleen and the kidney are in the long axis view. From here, slide the transducer towards the patient's head so that the diaphragm is visualized. It's critically important to visualize the diaphragm in this view, as fluid often accumulates in the subdiaphragmatic space. On to the cardiac view. From here, slide the transducer along the subcostal margin with the indicator towards the patient's right side. Now the patient's right side is on the left side of the ultrasound screen, as the indicator marker corresponds with the transducer indicator. In this view, the ultrasound transducer is held in an overhand grip with the transducer nearly flat on the abdomen, pointing through the liver and up to the heart, which lies just under the sternum. On the ultrasound screen, the liver is seen at the top of the screen, closest to the footprint of the transducer, and the heart is in the bottom part of the screen. You may need to adjust the depth, probably make it deeper to optimize this image. In the normal image, the pericardial sac forms a bright white border around the heart, and each of the 4 chambers can easily be recognized. Hang on for just a minute and we'll demonstrate what an effusion looks like. Sometimes the subxiphoid view can be difficult to get. For example, if the patient has a tender or protuberant abdomen. So, there is an alternative cardiac view, the parasternal view. It's a little more difficult to obtain, but it's worth learning for sure. For this view, you'll need to adjust the depth to only 10 to 12 centimeters because the heart is very close to the transducer. Place the transducer in about the third intercostal space on the patient's left side, right next to the sternum, with the indicator towards the left hip. I realize this seems odd, but we're making our image look just like the cardiologist's echo. If you turn the transducer so the indicator is towards the patient's right shoulder, your image will simply be reversed on the screen. In this view, we're looking at the heart in the parasternal long axis. You may need to rotate the transducer towards the head or towards the feet to bring the heart into the proper alignment. You also may need to angle the transducer towards the sternum. The apex of the heart is towards the left side of the screen, as our indicator is towards the patient's left. And the aortic outflow tract is to the right. Each of the chambers is labeled. Now that we've seen how to obtain each of the 4 fast windows and the normal anatomy, we'll briefly cover the positive fast. Free fluid or blood appears as black or anechoic on the ultrasound. In the right upper quadrant, fluid is often seen in the potential space between the kidney and the liver, known as Morrison's pouch. The image on the left is normal and the one on the right demonstrates free fluid in Morrison's pouch. In the pelvic window, free fluid is seen around the bladder. In male patients, the free fluid is seen to the left of the bladder on the screen. The image on the left is normal. The one on the right shows free fluid in the peritoneal space, superior to the bladder. In female patients, free fluid is seen surrounding the uterus. In the left upper quadrant view, fluid may be between the kidney and the spleen, but is most often found between the spleen and the diaphragm. The image on the left is normal, and the one on the right demonstrates fluid between the diaphragm and the spleen. Here is another left upper quadrant view. Note where the fluid is. It's above the diaphragm, not below. This is free fluid in the thorax, most likely a hemothorax in the trauma patient. In the subxiphoid cardiac view, a pericardial effusion is seen as an anechoic or black area between the heart and the pericardium. The clip on the left is normal, with the pericardium visualized as a single bright white line. In the clip on the right, the myocardium is visualized, then there is an anechoic space, then the bright white pericardium. The anechoic space represents the pericardial effusion. Lastly, the parasternal long axis view. This is the view with the transducer next to the sternum, cutting through the heart in long axis. In this view, the effusion in the image on the right is easily seen as an anechoic space between the heart and the pericardium. Note that the fluid extends beyond the descending aorta in the far field of the screen. This can be useful in distinguishing between pericardial and pleural effusions. In pericardial effusions, the fluid crosses over the top of the descending aorta. We've just gone through the entire basic FAST exam. Remember, when you practice this, angle and slide the transducer to optimize your images. Make sure you look above and below the diaphragm, and practice that parasternal long axis view so you'll know how to do it when you need it.